Now we shouldn't be muted.
This should be better now.
Mm-hmm.
Now we can keep on our philosophical talk and where we were going with it. Yep.
How exciting. This is exciting.
Yes, it is. Yes, it is. Friday afternoon. Beautiful day. Beautiful day out here.
Awesome. Officially recording.
Nice. So we are live and recording, so we're crushing it.
Okay, awesome.
Yeah, I was.
Okay, we got it. Are you ready to start?
Yep, I'm ready when you are.
I think the first thing we should do is introductions.
Yeah, that sounds good.
You guys, I am a Chapman alumni. This is my husband here. He is a Fullerton Sister School alumni. So if you guys don't know who we are, I'm Sandra, this is Randy, and we are the hosts of AT Corner Podcast.
Yes. So we're both certified athletic trainers. As Sandra said, she's an alumni of Chapman University. She completed her bachelor's and master's, and she's a graduate of the athletic training program at Chapman. I'm a Cal State Fullerton alumni. I got my bachelor's in athletic training from Cal State Fullerton, and I got my master's degree from Cal State Fullerton as well.
And then now we're both practicing as certified athletic trainers in the local area. We're both at colleges. I also work with performing artists because I was a performing artist myself. I am a product of Chapman Dance Department. So I know that a lot of dancers are watching today, which is really exciting to me and really close to my heart. So can you put that on, please? So we heard from you guys that you want a little demonstration today of KT taping, bandaging, and wrapping. So we kind of have a just general techniques that we use a lot in our practice. We're going to start with KT tape. That one's a big one that I do want to say as athletic trainers. Actually, first, we should probably talk about what athletic trainers do. If you guys have not had the luxury of meeting an athletic trainer, sometimes the name can be very confusing and we get confused with personal trainers. So what an athletic trainer is we're actually healthcare professionals who do anything from emergency care all the way to treatment, rehab, injury evaluation, diagnosis, all of those things. So it's kind of like we take some parts that you would see maybe a physical therapist doing, and then some parts that you would see an EMT doing, and we take the best of both worlds of those two, and we bring them together as athletic trainers.
Most of the time, when most people think of us, you usually think of when someone's injured, when you're watching a sporting event, the people that run out, that is us. But also athletic training has really expanded. Like Sandra said, we do have our hands in rehab and ergonomics. So a lot of athletic trainers are now starting to be found in industrial settings, like working at Amazon and FedEx and airlines
and Boeing
and working with their workers to help with ergonomics and workers' comps and stuff like that. Also law enforcement, military also hire athletic trainers for that. So the traditional of what everyone thinks of is an athletic trainer working at a university and a school is still there. That's what we do. But there are athletic trainers that also work in very diverse settings.
So some of the techniques that we're showing today, we do want to put a little disclaimer on in the beginning, and we just want to let you know that these things that we're doing, rarely, actually probably never, do we do these techniques alone. They're always a support of the other techniques that we're doing in rehab or in like for posture or for getting someone back from an injury, or we do other techniques. We definitely don't just have someone come in and tape them and then it's just kind of a band-aid. So some of the things that we're going to show you, we're definitely, we would like you to explore them, but just as a reminder, this is not the end all be all. Taping doesn't fix everything.
Yeah, I think that's very important to remember that these are quick fixes. This is stuff to you have a performance or you're just trying to get through your job without pain. So a lot of these techniques are quick fixes. They are used in conjunction with rehab and other treatments that are actually going to lead to more longer lasting effects, but they are helpful tools to help you get there. And the biggest thing, and we'll start out with KT tape. KT tape has really blown up in probably the past decade, maybe a little bit more than the past decade. We can really thank the '08 Beijing Olympics for making that very popular. Made me feel old because I said decade. So that tells you I'm getting old. But there have been a lot of claims that come out with KT tape about what it can do and what it cannot do. It was really popular to think like, oh, KT tape, you can increase muscle strength, you can activate certain muscles and deactivate certain muscles just from this strip of tape. And a lot of the research behind that is it's lacking. There's not a lot of support for those comments. So today I really want to focus on what research is actually supported with KT tape. And that is the fact that it is very good at relieving pain. And you can also use it in conjunction with rehab to help the motor learning process and learning new motor movements. So how KT tape relieves pain and how it works essentially is in your skin, because we're applying the tape to the skin. In your skin and underneath the skin, you have mechanoreceptors. The mechanoreceptors are in your skin and in what's called fascia. Fascia is just a giant net. If we all remember from anatomy class, if everyone's taken anatomy class, it's just the giant fuzz. It's the filler that supports the muscles, and it helps getting nutrition and helps their force transmission. These mechanoreceptors, their job is to let your body know what you're touching and what's touching your body. It gives you information about where you are and what you're in contact with.
So this is like real life. I'm sure you guys have heard those terms used in your classes, and this is stuff that we actually use in practice. So it's kind of cool to see how that stuff translates. I know when you're listening to stuff, you're like, when am I ever going to use mechanoreceptors? But when we're talking about tape, then especially KT tape, it's a really cool idea that you can actually apply that, what you're learning, to what we're doing.
So what we do with the tape is we've all seen like maybe videos or people using KT tape where they'll unroll the tape and then they'll stretch it and it almost like doubles its length. So what happens with that stretch is you're applying the stretch, then you lay it on the skin. The tape naturally wants to come back to its original length. Well, in that process, it's going to pull on the skin. If we're pulling on the skin and the fascia underneath, you're going to activate those mechanoreceptors, and that's how you're going to relieve pain. And that's how you're going to teach them how to move in different directions. Now, when we're thinking about applying KT tape, it's not used for everyone. There are certain things that you want to avoid using this tape on. That's going to be any open wounds. You're not going to put KT tape on an open wound. Anyone with sensitive skin, like children, pregnant women, anyone like that, or the elderly, they may not respond well to having a tape applied to them that is going to put stretch on their skin. That might irritate their skin. Also, you want to avoid using this tape if someone has sensitive skin. They could really irritate the skin. They can have an allergic reaction. Their skin can get inflamed in that area, and it can be very uncomfortable. So before you apply this tape, that's what you want to consider. Who am I applying it on? And is it really the best thing for them?
So we are going to do some demonstrations. So bear with us as we go through some of the I like to call it the fine print, because basically this is the stuff that you need to know before you actually do some of these things. So first thing I do before I'm going to apply the tape is I have to prepare the skin. And KT tape can usually last around 3 to 4 days. And I do let the patient know that because KT tape is expensive. So, I mean, not only that, but it does last. And so the last thing I want is to apply a tape and then for it to be working for someone and then not and have that miscommunication where that person takes off the tape that actually is helping them because they didn't know that it could stay for that long. So I do usually tell them first that it can last for 3 to 4 days. I always ask if they're allergic to adhesive. And I know Randy just talked about this a little bit. Can you grab me that little test patch? Thank you so much. So what I'll do, if someone doesn't know if they're allergic to adhesive, you can actually put a little test patch, like something that you just have a scrap piece. I usually put it like on the inside of their elbow right here. And that way, after 15 minutes, if you take it off and it's okay, then you're pretty safe. that they're going to be able to use this tape. You want the skin to be clean and dry once you determine that they are going to react well to that KT tape. So now something to note, usually if I'm doing KT tape, like I said, we're usually doing other techniques beforehand. Some of those techniques, I might be using lotion. I might be working in that tissue. I might be doing something where I am using like an oil or something that would make the KT tape stick less. So I want to be cognizant of that as I'm before I apply the tape. So I'm not going to not do those treatments, but what I can do to prepare the skin afterward is I can use rubbing alcohol to dry the skin. Also, if someone comes in and they have a lot of lotion on, rubbing alcohol is a great way to prepare the skin for the KT tape. Another thing, so Randy was saying we do apply the tape directly to the skin. What if someone's hairy? Well, you can trim the hair if it's impeding, but it is not necessary. I don't think I've ever had anyone who was too hairy that I couldn't tape them. But I mean, have you?
I haven't personally, and also my legs are pretty hairy, and the KT tape sticks pretty well to me, so I feel pretty good.
And you're still getting those effects because if the tape is pulling on the hair, and that hair is still attached to the skin, you're still getting those same effects pulling and in those mechanoreceptors and the pressure and everything that we're trying to do.
Yeah, so now comes the fun part. We're going to start jumping into some application. Just remember, as we apply these, we both have taken the rock tape certification courses. So we're basically going to show you the basic tape applications for a couple of musculoskeletal areas and conditions that they taught us. But the fun thing with KT tape is you can get creative. You don't have to, there's more than one way to apply this tape to a certain body region, and then demands will change based on what you want and what your patients will want. So this is a good jumping off point, but this is not the only way to like tape a patellar tendon or anything like that. So just keep that in mind. So go ahead.
I was going to say the biggest thing is to listen to the patient. So if you do it one way, and even though that's the way that the book might say, or that's the way that we do it, or it's really important that the patient is the one who's going to be wearing the tape. And so it's important that you listen to what their needs are. And if you need to alter that tape in any way, that's really important.
All right. Ready?
Yep.
Let's do this.
What's first?
It's the fun part. We're going to start with taping for the patellar tendon. So this would be anything for patellar tendinopathy, patellofemoral pain syndrome, any pain that's essentially on the anterior knee, you can probably use this technique for.
All right. You want me on the table?
Yep. Go ahead. Hop on up.
So we already pre-cut the strips, so it would be easier application. They're really easy to cut with just any nice pair of sharp scissors, as shown here.
So how you'll start them off is I like to have them seated with their knee and knee flexion slightly bent like this. And then what I'll do is I add the first strip. So you'll add the first part of the strip with no stretch. So you just essentially just take it off the roll, off the paper, just like that.
And the ends, you want to make sure to have no stretch, because the more they stretch at the end, the more likely the tape is going to come up at those ends. So those are kind of like your anchors.
So then what I'll do is the amount of stretch is kind of up to you, how you want to do it. I'll do a light stretch. So a lot of times they do a percentage. I do about 25% stretch. And then you just come up, wrap around the kneecap, and finish up there.
So the reason why what he's doing right now is he has the backing of the tape, just the paper that comes off of it. And what he's doing is he's rubbing the tape, because heat actually activates the adhesive. So because we want this to stay for a couple of days, activating that adhesive is the way that we really want.
Now, since we're going to add a second strip, just like we did this one, just going the opposite way. So it's kind of similar here. I'm going to apply this little anchor strip, no stretch.
We didn't prepare my skin. That's why I came off.
And then kind of same thing before, about 25% stretch. And then you're gonna wrap around the kneecap. And then same thing, you're gonna rub. Now, how Rock Tape teaches their KT Tape courses, these first two strips are what they call anchor strips.
So I'll come forward so you guys can see as well.
So they call these two strips anchor strips. Essentially, it gives a base for the third strip to stick on, and it's adding some stimulus. This last strip is what they call a decompression strip. So what you do is you split the tape right down the middle. You get your ends to expose the middle. And then you find whatever area is the most painful.
So let's say I have pain right here.
And then what you'll do is you'll have your tape, you add a little bit of a stretch, you put it right on the middle. And then last thing, same thing, you rub it in. So the idea with the decompression strip is I pulled it like this and applied it. So now the tape's pulling this way and it's going to decompress the skin. Same thing, it's pulling on the skin. So you're going to get a stimulus that way. And you can also look at it as it's creating an opening for more blood flow to that area. And the important thing is this is just one way to do it. A lot of times what I'll do is the whole point of the tape is to get stretch of the skin. I'll even pair laying down the tape with movements. Sometimes I'll have them actually bend their knee even more as I lay the tape down, just because it adds more stretch to the skin. That's one way you can modify it, but it's totally up to you.
And the patient. So our next technique is going to be for plantar fasciitis, and I'm actually going to bring this closer so you can see. This is also a good reminder. Once you put the tape on the patient, you want to remind them that the tape can get wet, so they can shower if they need. If they're a swimmer, you can use KT tape. I would just recommend you get the H2O brand, so that that is specifically made to be submerged in water, so that it does stick as long as you need it to. So this is kind of like what Randy was saying before. This is the first strip I'm going to apply, and this is for plantar fasciitis. So first, what I'm going to do is I would prepare the skin, but I want for plantar fasciitis, if you guys are not familiar with it, we are usually getting pain more lower here at the bottom of the near that calcaneus bone, if you guys have taken anatomy. But I want to have some decompression in this main area where that fascia runs. So what I'm going to do is the end I'm not going to stretch. So I'm going to apply this here. I'm going to prepare my tape so it's ready. And I'm going to stretch, apply as I go. And then the end I'm just going to roll on, just like Randy had done on my knee. Okay, use this piece. Rub to get that adhesive. And then this strip we're going to use on the medial side of his leg. So you guys can't see this right here, but we'll show you after Randy stands up. I'm actually putting an anchor right on the outside near that cuboid. And then I'm going to wrap medially, which is the opposite of what we would do for an ankle sprain, because usually if you have someone with an ankle sprain, they're going to invert their ankle or supinate. And so that's the opposite direction that we'd want to tape an ankle. I'm just applying this here.
So this is the ultimate test because I got really hairy legs. So we're gonna see how long this tape lasts on my hair.
So now you're gonna go ahead and stand up. Usually this is when I would have the patient go ahead and test it out. Take a few steps for me.
So you can't really see it very well.
So go ahead and show the outside. So this is where I placed that anchor strip. It's probably going to stay better as well too. And this is the bottom.
Perfect.
Can you explain to them, Randy, how you're feeling with that tape on? Like, how does it feel on the bottom of your foot?
I think the biggest thing that I would say is it feels like what the tape is doing. Like I feel the pull of the tape and where she applied the tension, that's where I feel the pull. So that's the sensation that you're looking for when you apply this on yourself or on patient. You want. And a lot of times I get especially when I use it for motor control and motor learning, a lot of them are like, oh yeah, man, I just feel it pulling. I'm like, exactly. That's what I wanted to do. Mm-hmm. So that's really what you're going for when you use this tape. So the next one we'll do is Achilles tendon pain or Achilles tendinopathy. So if you don't mind hopping up. Yeah. No, that's good. I think I'll break it down in pieces. So what we'll do, because this one's tough because she's gonna have to be laying down. So I'll break it down. There's only 2 strips for this application. So I'll have her stand up and show you how each strip is laid down. So let's have you go ahead and lay on your stomach with your foot just hanging off the edge of the tape. Okay. So similar to all the other tape applications, you add a first anchor strip. So where I'll go here is just anywhere on the lower part of the calf or the 2 gastroc muscles or the soleus. So I'll go here. And then I'll have her in a little dorsiflexion, so bringing her toe up.
And if you think about it, the Achilles tendon is part of the gastroc complex, which does plantar flexion. So the reason why he's having me in dorsiflexion is because that's the way that you would stretch the muscle. And so when I plantar flex, well, this tape is going to help me bring me into that plantar flex position or help remind me after we do that rehab.
Go ahead and stand up and show me. So this will be how you'll kind of apply the first strip. Look just like that. Where you end doesn't necessarily matter. You can end here. You can even go a little bit lower. It's kind of up to you and the patient what they're comfortable with. And if you're just know the lower you go, the higher chance the edges can catch and then start to roll up. And then go ahead and lay back onto your stomach. And then this last strip is the decompression strip. Go and go back into the torso. Perfect.
And this one, you're going to want the decompression strip to go over that area of pain. Same as the rest.
And then same thing, just activate the adhesive. And go and show.
Oh, yeah.
So then same, like we said before, this decompression strip can be moved depending where their area of pain is. I just picked an arbitrary spot just right there. Nice.
All right. The next one we're going to do is the scapular retraction tape. And honestly, of all the tapes that I use, this is probably the most common that I use. And the reason why is because if I have someone who I look at their scapular movement, which is your shoulder blades, if I have them move and I see that when they're moving to the side and down, if they're not able to get that full range of motion, what I do is I use my hand to bring them back into scapular retraction. And then I retest them. If I bring them up all the way again, and they're able to get more range of motion there, or if they were not lacking range of motion previously, but if they had less or fewer symptoms on the way up, then it would indicate that we need to work on scapular stabilization. So I would not just apply this tape. First, I would start working on scapular stabilization. I would work on core, some stuff like that. And then I'd look at where they're tight, where maybe need some mobility. And then to assist all of those other techniques that I'm doing, I would use a very long strip that assists them to actually uses, it's kind of like a little reminder, like, hey, you need to be in scapular retraction. And as humans, we are not meant to be in scapular retraction or actually in any position 100% of the time. So this is a good little reminder throughout their day that they should be either moving in this as they're moving their arm throughout their daily activities or in their sport or whatever. So this usually, I forgot to add this too. You can also, if you want this on longer, you can we use an adhesive spray on top of the adhesive that's already in here. Honestly, this tape is really old, so it's not going to stick in general. But if I were actually applying this on a real patient, I would actually probably apply an adhesive tape first. So for this scapular retraction, what I want to do first is have the patient in the position that I want them to be. So you can see Randy's scapula here and here. And what I'm going to have him do is I'm going to apply it on this side. And so first I'm going to have him pull down and back into a good scapular position. Okay. I would probably cue the patient more, but Randy's an athletic trainer, so he knows where that position is. So what I'm going to do is, again, these ends, they're going to stay no stretch. And I'm going to apply this just in the front. Another thing that I forgot to mention actually is, so these are actually pre-cut, but if you don't have the pre-cut ones, you can actually take this back and measure where you're going to need to go. And then that's where you would cut. So because we already cut these, we don't need to do that. Go ahead and go to your position. Perfect. I'm just going to follow the line. So the front anchor, I'll show you once Randy turns around. But basically what I'm doing is I'm applying a little bit of stretch down this medial border of the scapula. And then I'm going to go all the way down into this posterior sling. So what this is doing is Randy's going to slouch for me. And this tape is now fully stretched with him slouching. And so it's basically serving as a reminder to get him into that scapular retraction position. And as a reminder, we would be doing this either in rehab or if they are like a throwing athlete and we have worked on their technique and worked in where that we found that this is what they need, then I can use this to kind of be my finger without me being there while they're throwing. All right, Randy, you want to show them the front? So this is just where I have it here. Go ahead and squat down, show. Yep, nice tan. In addition, right there. Perfect. So then this next one is a shoulder tape. You want to tape my shoulder?
Yes, I thought we were doing the cross.
Oh, nope. I was just going to do one.
So that is one important thing that Sandra is saying is I do like using this one as well. I especially like to use it, apply it on a Friday when I know I'm probably not going to see the athlete until Monday. So I can't work on their scapular program Saturday, Sunday. This is one way that I can actually keep working on it. I just apply the tape and it's working for me. So it's another way that I can increase my outcomes and hopefully get them learning how to use those muscles. So when we see rehab on Monday, we can progress them a little bit more.
And of course, none of these tapes are providing any sort of support. It's more as a reminder of some of the things that we work in rehab. So a little bit later, we might show you some tapes that actually are used for support.
So this next one, we're going to keep with the trend of the upper extremity. We're just going to do the basic one for the shoulder. So if you don't mind rolling up your sleeve. So the
I
idea,
also have a tan line.
you know you're an athletic trainer when you have tan lines like this. So similar with the knee, you're going to add 2 anchor strips with a decompression strip. So kind of same thing, you're just going to go around the shoulder.
So this is actually going to look very, very similar to the knee.
So you see it kind of go around the shoulder just like that.
So right now, what I'm feeling is the tape is assisting me into this abduction, if you guys have learned motions, abduction position of the shoulder. Because if you think of where the line of tape is, it is pulling the skin and pulling me into that abduction.
I'm just going to come up. So now we have both anchor strips. And similar to what we did with the knee and the Achilles, you're going to ask where the area of pain. Where's your area of pain?
Right here.
Right there, right in the middle. Just apply a nice little stretch to it. And you just lay it down nice and gentle.
And then while we're here, this is actually the perfect moment to show tape removal. So usually I tell people that you can just take the tape off when it starts to fall off, which is usually after 3 to 4 days. But if you need it off before then, so like for example, I had a baseball player today who I wanted to do a different treatment with him where I actually needed to be on the skin. And so I actually took his tape off. Fresh tape, this is not fresh tape. Fresh tape is very sticky and it is definitely painful to take off if you don't do it the correct way. So this is a technique that we use to take off the tape.
Yeah, so you can do most like different things to take it off. The easiest is in the shower or with hot water or well, warm water, I should say.
Or using baby oil. Or
baby oil can help get the adhesive off. There's de-adhesives that you can buy that can also help take it off. If you don't have any of that and you're just trying to rip it off, the easiest thing you can do is once you get an edge to it is going back to those mechanoreceptors, right? Anytime you activate them, they can help decrease pain. And what you're going to do is you're basically going to create a stimulus on the skin as you lift the tape up. So all you're doing is gently patting the skin. You're not coming in and blowing them up and like punching them. It's just gentle patting. You get those mechanoreceptors and it makes the tape removal process a little less painful.
All right, so we are just at about 30 minutes. So we're gonna actually transition over to 2 other techniques for you guys. So first, we're gonna talk about ace bandage. So ace bandage, basically what this is, usually what we use it for is for compression. And then sometimes we can use it to assist movement. So the first thing I'm going to show you is for an ankle. So if someone sprained their ankle and you know that it's going to swell up, what you want to do is apply compression. The reason why is because what we want to do is prevent that swelling as much as we can. There is some literature moving away from certain techniques in the inflammation process, and because we're finding that we don't want to inhibit inflammation all the way. And so, but it is pretty safe. You can use this on an ankle. So can you actually angle this way for me, please? Perfect. So someone just sprained their ankle, what we're looking for is first, I want to make sure, I know that this is probably going to be a little bit difficult for a patient to do on their own, but if they are able to get into this position is the position that I do want to wrap them in. Because if I have them in this position and then I do it tight, at the moment they step on the floor, it's going to add that pressure and it's going to be too much in that position. So this is the position that you walk in. This is the position that we want to apply this. You always want, because swelling has to go back through the lymph system, what we want to do is apply our compression from distal, the furthest part away from the heart, to proximal. So we want to move toward the heart. We want to move in the way that we want the swelling to go. So what we're going to do is we're going to take this and I'm going to start basically just at I'll show you right here, under those toes. If I start right here, I guarantee you very, very soon, this area is going to be very swollen because this is the only area that doesn't have compression on it. So I'm going to just start here. There's a little bit of debate whether we should hold the ACE wrap this way or if we should hold it the other way. We both prefer to hold it this way because I feel like both of us feel like we can get more tension on it. So whatever way is more comfortable for you. There's actually two techniques here. I'm just going to show you the one where you just go overlap. You want to overlap around half the ACE bandage at a time. The most tricky part in all of this is getting that heel and not getting a little hole on the heel. So especially like right back here, there's a lot of times people leave a hole right where my finger is. So there's a couple things you can do. You can either, what we do in an ankle tape, it's called a heel lock, where you come down and around the ankle. You can go that way, or you can continue wrapping in that same direction and then just make sure that you're overlapping and making sure you're not leaving a hole. So I do want to add a decent amount of stretch. If I stretch this all the way and pull it, then I guarantee you he's not going to have any circulation in these toes, and that is not our goal. So this ACE bandage is actually a little bit long because we grabbed a double 4-inch instead of a single 4-inch. But imagine that I was at the end of my roll. Right now, I have a couple of options to finish off an ACE bandage. So I can either use those little tacks that came with it, which honestly, like, I don't ever use those. I can also just place tape around it and just tape the whole top. The only thing that I don't like about that is if I'm going to send one of my patients home with that, they usually don't have a roll of tape at home. So how are they going to put it back on, especially if they're going to go home and shower or something? So usually what I'll tell them to do is you can either take the end and tuck it in where you already went over, or you can take that and you can tie a knot just in that same, it's kind of hard to do with this excess roll, but if you could imagine just taking this and tying a knot right here. Those are both solid options.
Yeah, no, that's perfect. I think that's the important thing is you normally wouldn't use a wrap like that's this long for this just because you have a ton of excess, so you use a little bit smaller one, but the technique is the same.
And if you're going to wrap any other part of the body, you want to make sure you are still going distal to proximal. And the same thing, you want to make sure that you are at least, like let's say a knee, you want to make sure you're at least 2 to 4 inches below the site and then 2 to 4 inches above the site.
Also, this is a really good thing to have because we talk about this for swelling, and that's really what you'll see it for in our work setting. But this could also be a good thing to have handy on like your hikes or anything like that, where if someone trips, falls, sprain their ankle, having a difficult time walking, this can at least give them some support while they're trying to get back to their car or back to civilization. Okay. So that technique there was for the ankle. So now what we'll do is we'll now use more techniques for the hip, and actually this way of wrapping the hip is actually for support. This is to either protect the hip flexor or it's going to help protect your groin muscles, so your adductor muscles. So the first one we'll start with is the hip flexor. Do you mind sliding that back just a little bit? So the easiest thing you'll want for when you're taping a hip is you're going to want a pretty big roll. So compared to the one that we use for the ankle, you'd want pretty little bit bigger. You know, this is 4 inches. This is going to be 6 inches, and it's a double. So there's 2 basically in this one. That makes it longer, as this was a 4-inch double. So to tape the hip flexor, what we'll do is I'll actually have you step this foot forward. So the side that you're going to try and tape is going to be the one that's forward. Go ahead and lift your heel up for me. I like to add a heel block to it just to keep their foot relaxed, get a nice bend to their knee. It kind of helps support. If you're in a bind, you really don't need it, but I like this position. So what you're going to do is you're going to start on the thigh. You're just going to go around like that. Kind of the same thing as before. You're going to overlap it about half. And then important with the hip flexor wrap, what makes it different than the groin and hip adductor one is you're pulling out. So if you're pulling in, you're probably going more for the groin muscles or the abductors. And most of your tension when you're doing this is you want it right over the hip flexor, which is going to sit right in there. So as I come up.
If you guys have not taken anatomy, the hip flexor does exactly what it says. It flexes the hip. So basically this is pulling me into my hip flexion position, which is why we're pulling the ace bandage in this direction.
So I'm going to apply tension, and you just want to do gentle tension because you're going to go around maybe 2 times. If you come in and you like add a ton of tension, the leg's going to fall asleep. You're going to cut off all that blood flow down there. So you don't want it too tight because it's going to get uncomfortable. So you add tension there. You come around, you're just going to kind of go above where their buttocks would be. And then you're going to cross it. Same thing. The idea is you're going to try and add tension to where the X is. So you're going to just pull down, and then you're going to go again. Same thing. You're going to add tension.
So if you're doing this before someone's practice, you're going to want to have them go to the bathroom because they're kind of locked in after you put this on. So they're going to have to take it off if they need to go to the bathroom. So just a good reminder before you apply.
So you kind of go off of how much roll you have left. I had enough for a third one. So it all kind of depends on how much support you want. Same thing, get a nice little tension there. And then you just finish off down here. Now, usually when you do this, similar to what Sandra was saying with the ankle one, I'll more than likely finish this off with tape, and then you just do the same thing with the tape. So you'll grab stretch tape.
While he's doing that, I can tell you right now, I'm getting some nice compression in my quad right here, but then also as I put my leg down into my hip extension, what this is doing is it's essentially, if I just relax right now, this is where my leg is hanging. Versus if I would relax my other leg, you see how it's not going into that hip flexion?
So then now what I'll do is I'll grab a stretch tape. It's just very light. It's very stretchy. And I'll just do that same thing one time around. What's wrong with it? So from here, same thing with the tape. I add the tension there, come around, pull down, and then she's ready to go. The stretch tape helps keep this in place because as you're moving, as you're working out and sweating, it's going to get really loose. Parts are going to start slipping or coming off. So this kind of keeps it in place, and it helps add a little more rigidity compared to just the ace bandage. So the idea is kind of what Sandra was saying, is it's going to help that hip flexor bring that leg up, but it's also an important thing is going to prevent you from going into excessive hip extension, essentially protecting that hip flexor.
So I just want to take this moment real quick and see and check in because we actually are on a live stream, but we're not seeing the comments right now. So I just want to check in and see if we have any questions or how we're doing on time.
Hi, you guys are doing great. You've got 4 viewers right now. They're kind of coming in and out of YouTube. We don't have any questions, so you guys can press on.
Awesome. So we do have techniques that we want to show you. We did talk about the rigid tape, and this is the tape that actually would give you a little bit more support. And for those dancers out there, this next one that we're going to show you is one that I use with my dancers all the time. And that's because it's an arch tape. So technique on Randy.
Did you want me to do the hip abductor or we don't need to?
So the hip that we just showed you is the exact opposite. Well, it's the exact same thing as if you were going to do a hip adductor or a groin strain, except you pull down towards. You want to show just pull the way you would pull?
So like I said before, for the hip flexor, we're pulling out. This time we're actually going to go in. So you're going to be here. And right where that crease is, you're doing the opposite of what we did for the hip flexor. You're pulling towards the body. Same thing, you're going to go around the buttocks, come down, and then now we're pulling down and in.
So then if you can imagine, he doesn't have to finish the tape,
Yeah,
but
so you see.
But basically what this is doing is now it's bringing my hip down and in instead of up and out. And so then if I have a groin strain right here and I'm trying to avoid this being stretched, then that's when I would want to bring my leg in down this way. And then now we're going to go ahead and get set up for you for an arch tape. You do that same diagonal setup that we did. I'm going to take this right off. Oh, this one actually stuck. Pretty good. All right. Thank you for grabbing this for me. So like we said before with the scapular retraction tape and how I measure it, what we're doing with this is this is my favorite tape ever. It's called Leuco tape. You can get it on Amazon. It's very, very rigid, perfect for arch tapes. Basically what we want to do with this is measure from just a little bit pulling up on this outside so it has somewhere to grip. That's what my anchor is. And then we also have up, we want to get on the top of that foot. And usually I'll go ahead and measure once and then I'll rip about 2 to 3 strips, depending on how big their foot is. So if I'm going to do this with some of my football players, then I'm probably going to do 3 strips, and some of my smaller dancers, I can get away with 2 because their arch is little.
It's also important to know, like you said, this tape is very strong and the adhesive is very sticky. I've used a technique similar to this with the same tape, and you can actually keep the tape on a couple of days. So I know college students were all balling on a budget. So if you didn't want to have to constantly retape and buy a lot more rolls of this, you can try and keep this tape on for a couple of days if it stays on.
So a lot of people do this very simply. Something that I add to my arch tapes that is I get a lot of great feedback on from my dancers, from my athletes, from my patients, is I actually find the goal of this is to help that navicular lift. And if you don't know where the navicular is, it's your arch bone that is in just kind of below that halfway mark of your foot. And it's the bone that sticks out. So basically what I'm doing is you have a very high arch. So this right here, you guys can't see this. So basically what I'm doing is I am palpating. I'm trying to find the camera. There we go. This is very confusing to do backwards. Okay. So I'm palpating in his navicular. This is what I am trying to lift. So find that bone. I keep an eye on it. This is very light. I'm just putting that down just the same as the KT tape. Now I'm taking my fingers on that side right here. And this is where I apply the pull and stretch. Usually this table is pretty low, but usually what I'll do is I'll add my body into it and then I don't let go. I really apply a lot of pull to that tape. I don't let go until I lay that tape down. So you can go ahead and see from this view how I'm applying it this way. So have just one of these here. My navicular, I already found it with that first strip. And what I'm doing, this tape is actually going to go just slightly forward. And then I'll do another one where the tape is just slightly behind that. So if I'm just doing 2 strips, I just want to make sure to overlap so they're not both in the same place. What I'm doing is actually applying that pull, and I want to just fan these 3 out. So when he steps down, that navicular is not dropping as much, but it's being supported by this tape.
Now, if you've never had an arch tape applied to your foot before, when you step down, it's going to feel very weird. So it means it's doing its job, because most time your arch is supposed to come down a little bit. If it drops too much and you're too flat-footed, or it has a tough time coming back out, that's where we have issues. So that's where you get that weird feeling. You're used to having your foot kind of come down a little bit more. This is restricting that motion.
Awesome.
All right. Then we got thumb. So this next taping application is going to be for the thumb. It's very common for a lot of ball sport athletes, whether it's volleyball, basketball, soccer, to have a thumb injury, essentially where your thumb gets jammed and it pulls and it opens up too much like that. So this is a way to help support that joint that sits right in there and support those ligaments.
Actually, the last one you want to do?
Yes. Them grabs pretty right.
Yeah, you can do it right on.
It'll stick a little bit better.
Okay. So I will usually do this without this pre-wrap tape. A lot of different clinicians will do different things. So that's just the beauty of athletic training.
So first, before you start this, you need to have something to anchor off of, or the tape won't stick very well. So I'll add an anchor around the wrist. So when you're taping, anytime you're around the wrist, you're going to have them spread their fingers. So all these tendons and vessels that come through the side of the wrist can expand. Just add a little bit of pre-wrap for my tape.
Another way that I like to explain it is you can have them do a claw. A lot of times I use this for when I'm working with high school, because sometimes they just don't understand what they're supposed to be doing with their hand in that position. And so that claw is just a really easy position to get them to expand their hand.
Now, it's important to note, so there's that part, so that would be the wrist part. Because I'm doing the thumb, I'm actually going to come onto the hand a little bit. So what I'll do now is I'll actually come over the hand. I'll pinch the tape as it goes into the skin right before the thumb, because that's a very sensitive area. You don't want the tape to rub there. And then I'll just come down and then back up. So that's my anchor. And now, same thing, we're trying to protect this joint. So a lot of times the issues come when they're being pulled back too far, and that's where it'll really stress. So my cue for them is to like hold a can of Coke or hold a can of Pepsi. So it kind of comes down just like that. And your whole idea of this tape is you're trying to prevent them from going back. So I'll add my strip there. I come around, I'm pretty gentle most of the way, because you don't want to cut off circulation to the thumb, until I get to about here. And then what I'll do is I will actually pull down just a little bit.
The biggest thing we see when people are first learning this tape is that they do not tape over this joint that we're trying to manipulate.
Pull down just a little bit. Nice and gentle. And then, so a lot of times you'll only go around 3 times. If that's too restrictive, you can actually edit it and just take pieces out. You can maybe go around once, you can go around twice. And then after that, you want to anchor it down. And then you'll do what's called C strips because they make a C. So you just come here.
You can see how much pressure Randy's applying, because I'm not able to hold my hand in a stable position.
And then if you really want to get fancy, you can actually close it up because now it'll hold the other strips down. And now it looks a little prettier. So now her thumb will have a hard time going out, and you have to gauge how strong you want to make it. So if it's too tight, some athletes may not like it because they actually need to come out a little bit. Or if they're in a position where they don't really need that much mobility in their thumb, this may be perfect because their thumb's really not going anywhere. But they can still come across and touch the pinky. There we go.
Last thing.
Are we doing it? The coup de grace of, I hope I said that right, of taping, and that is what everyone's classic, everyone's favorite is the ankle tape. So go ahead and.
So this is probably something that you've seen athletic trainers do before. Would you like me to be diagonal?
Yes, go ahead, please.
This is the same thing that we were talking about before, where we do want to have them in that locked out position in that dorsiflexion. This table is also pretty low. And so usually our taping tables are actually going to be a lot taller to protect us as the clinicians, because yes, that athlete is very important for them to get taped. But it's also important that we take care of ourselves.
So kind of what Sandra mentioned before, I use pre-wrap for my ankle tapes.
I do not use pre-wrap for my ankle tapes.
So if you're not going with pre-wrap, and even if you are going with pre-wrap, adding an adhesive with this does make it a little bit easier and makes it a little bit better. The tape will actually stick better to the ankle. So
you also want to do heel and lace pads, which we don't show you here, but basically what there are, they're little foam pads that prevent blisters in the front and in the back.
So when you're adding the pre-wrap, you really you don't have to do it in any certain fancy way. You can really just go up the ankle and that's fine. The more important part will be the actual tape. So the first tapes you'll want to do, as we have done with all the other tape applications, are anchor strips. For me, I do 3 anchor strips. All these are just strips that go across the ankle. Just like so. Now, the next ones are called stirrups because they're going to look like stirrups. Now, most ankle sprains are going to be because of an inversion mechanism, so where they turn their foot in like this. So we're trying to prevent that motion. So what you'll do is, to prevent that motion, you're going to start on the inside. So you're going to start on the medial side, and then you're going to pull them laterally, just like that. And you're going to add 3 of those strips.
So you guys, next time you watch an athletic trainer do an ankle tape, I want you to pay attention to the order of how they do it, because we all learn a different way, and we all in practice change our ankle tapes how we see fit. Some athletic trainers even change their ankle tapes based on who they're working with, because maybe my dancers aren't going to need so many stirrups, or I'm not going to put what he's going to show a figure 8 on them, because the figure 8 keeps them in this position where dancers need to be able to go into their full dorsal or their full plantar flexion position. So really, you can alter this how you need it.
So now that I added the stirrups, I have to basically tack down those stirrups. So I'll add a strip or 2 there. And then I will add a little bit of a filler at the bottom to help close up some of the exposed skin. And then I'll add my figure 8, kind of like what she's talking about. And the reason it's called a figure 8 is because it basically creates an 8. You might slide out just a little bit. Thank you.
Let me show them from this angle.
Do you want, where do we move it to?
So you guys can watch from this angle so you can see.
So now that I added the figure 8, now what we'll add is what's called your heel locks. Just a little bit. So we'll start here. And then what you're trying to do is that bone that sticks out, that lateral malleolus, you're trying to cut it in half with the edge of the tape. So you're gonna come here, and it's gonna wrap around the heel. You can come up, and then you go around. Same thing on the other side now. We're trying to cut that medial malleolus in half, wrap around the heel, and that is one full heel lock. And now I'm gonna do 2. Come around, split it in half, lock the heel, come up, and same thing. So now those are my two heel locks. So now that we did that, we're pretty much done. Now I'll just close it up. I'll add a little bit of an arch support too, to close off the bottom. But important, as you're coming onto the outside of the foot, you don't want a lot of pressure there. Because as they step down, their foot still needs to expand. And if you have it too tight here, it's going to cause a lot of pain.
Perfect. So as we talked about before, taping honestly as athletic trainers is something that is like maybe a percentage, a basic percentage of what we do. Really, it's just an addition to the techniques that we are really using to get people back to doing what they love, which is what we love. So we hope that some of these tutorials helped you. Obviously, you can't really learn an ankle tape from the 30 seconds that we showed you, but we hope that it opened you up to seeing some of the different things that you can do. And I know that you guys can totally try some of the KT tape stuff we showed you, some of the ACE bandaging stuff that we showed you. So go ahead and play around with that.
Great job, guys. Thank you so much.
Yes, thank you guys. We appreciate it.
All right. Take care. And we're going to go ahead and stop